Okay. So hi, evening friends, evening everybody, bache, evening everybody. So I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hemat-oncology, AIIMS Delhi. So let us start. Let us start with our today's session. Low DNB pass percentage. Is it worth it? Now, before I even go further, what is the need of this session, or what is the aim, or what is the target while we are doing this session? I have three main targets. The first thing, like, we are going to talk about it and we are going to decide this session, I mean at the end of this session हमारे दिमाग में बिल्कुल clear होना चाहिए that what is to be done firstly. The second thing that we'll be doing in this is we'll be seeing with respect to NEET PG 2022 how to plan. Nothing is absolutely certain at present, but I'll be giving you a schedule that this is the best way to go forward. And lastly, what is the effect of delayed counseling on NEET PG 2022? These are the three main points that we will be discussing in our this session. So let us start. Let us start with our first point. Ki what was the whole purpose? DNB उठानी है कि नहीं उठानी? This is a question that many students are asking me per se on DM and stuff, because this was very much advertised in all the groups कि जून 2021 का जो सेशन हुआ था, this was our latest session, that is the June 2021 session. The pass percentage was actually dismal. Ortho, ENT, I mean the pass percentages, they were very low in the initial in the clinical fields, especially the surgical ones. ऑर्थो में तो बिल्कुल ही 18 पे बैठे हुए थे. ENT path usually has a pass percentage of more than 60%, but this time it had flunked. Anesthesia जो 80% usually होता है, this time it was down to 42.4% or something like that. Does it affect us? Does it alter our thought process? Will I base my decision of picking up a DNB seat seeing these values or not? Absolutely not. It does not matter. I am going to say this very clearly. When you are going to enter into DNB, देखो सबसे पहले life has to move on. You have to realize that you have to come out of this rat race. The life has to move on. The life will move on only when you will leave the first race and enter into the second one. See, in the end, Jeevan Sangharsha, I know I've said it as a very cliche statement of a Hindi Bollywood movie, but this is actually a fact. Do not let the low pass percentages affect you. बच्चे अगर 3 साल में नहीं, if not in 3 years, you will be getting your degree in 3.5 years. How does it matter? You will be learning new stuff, you will be increasing your CV, and you will know कि हमारी पूरी life, this is what I have to do my whole life. You will be fixed in a particular branch, and that actually matters a lot in the long run. During MBBS, जब हम लोग MBBS कर रहे होते हैं, we have absolutely no idea in which direction our life is taking us or something. Once you will enter into a field, it will actually be helping you. So do not let low pass percentages affect you. Firstly, next point. After having said that, should we what Asha, before I go to NEET PG 2022, how to plan for the same, what will be the effect of the delayed counseling? Think of it yourself. The counseling is massively delayed. The next NEET PG date is almost out. अब सबसे बड़ा क्वेश्चन, तो पहली चीज तो ये क्वेश्चन है कि will it be held in March or will the NEET PG be postponed? What do you think? Will it be in March or will it be postponed? देखो, three things can happen. They take the paper on time and then delay the NEET PG 2022 counseling. Both the batches join together. Both batches joining together is extremely low circumstance, or they postpone the paper. Nothing is certain yet, but if I was a student in your chair preparing, I will prepare and I will make my schedule in such a manner as if the paper has been postponed by at least 1 to 2 months. How will this affect me? This is going to affect me because I will firstly be laying more stress on the final year subjects. देखो, जब पढ़ाई करनी है, when you have to make a schedule, you always start with your major subjects. There are 4 main final year subjects: surgery, medicine, peds, obs, gynae. You have to do them very well. Couple it up with path, pharma and PSM. Couple it up with path, pharma and PSM. I am saying so because these 7 subjects, they form the chunk of the paper. Let it be almost any paper. Give at least 5 days to each of these subjects. When you multiply it by 5 days, you have already spent about 35 days of hardcore study time. Within the next 30-35 days, the picture will be much more clearer whether the paper is on the same date or whether it is being postponed, because तब तक कोई ना कोई notification आ जाएगा. Irrespective of whether the paper is on the same date or whether it is postponed, in both the circumstances, this is going to actually help you a lot. Now, the biggest question that majority of the students are facing at this point is कि sir, on the basis of reservation, either I will be getting an advantage or I won't. So I do not know कि मैं पूरे तरीके से पढ़ने बैठूं या ना बैठूं. Again, before we go to this question, my question to you is, if you are my very sincere suggestion to you is, if this was your first attempt, but you do not compromise on the degree. Do not compromise. Let me put it in capitals. Do not compromise even on the degree. That is, do not take DNB, same branch also, over MD. We will be repeating if it was our first attempt and if we are not getting the branch and degree of our choice. If you have already dropped a year, then consider DNB as equivalent to MD and pick it in the same branch. No doubt about it, firstly. Secondly, consider DNB clinicals as slightly superior to MD paraclinical. That is, until and unless you do not want to do clinicals at all. Until तुम्हारा thought process है कि नहीं, listening to the patient gives me headache, I cannot go to the hospital every day, yeah, I want a cool, calm, comfortable life, no night duties, nothing. Until these are not your thought processes, consider DNB clinicals slightly superior to MD paraclinical. That is, if you want to take clinical branch. Next, the last case scenario is, we have already dropped a year, I have already dropped, but I am not satisfied with I am getting. So, however, despite this, I am not able to study. Despite knowing this, that I am not satisfied, chances are that I will not either be getting my branch nor the degree, but still I am not able to study. Momentum नहीं आ पा रहा है. For that I will actually just like to show you one video of the same. देखो, सिर्फ इसको हम एक बार देखेंगे. Elon Musk, he has actually beautifully
one of the
said
biggest mistakes people generally make, and I'm guilty of it too, is wishful thinking. You know, like, you want something to be true even if it isn't true, and so you ignore the things that you ignore the real truth because of what you want to be true. This is a very difficult trap to avoid.
So this actually, एक बार just
one of the
listen to
biggest
this,
mistakes people generally make, and I'm guilty of it too, is wishful thinking. You know, like, you want something to be true even if it isn't true, and so you ignore the things that you ignore the real truth because of what you want to be true. This is a very difficult trap to avoid.
Actually, many of us fall into this trap of wishful thinking. We wish something to be true, and somewhere our rational mind knows that it is not, but we are waiting for some confirmation from somebody else. Many students, it is help bache, I'll just come to you. So avoid this trap of wishful thinking. Avoid this is the biggest trap that actually you can fall into, and many of you are in this trap at present. I mean, tell me this very, very truthfully. Mostly say after dropping year to choose a whenever it is important. Nahi Devraj, nahi dost, देखो, we cannot, for our dream branch, I mean, what Devraj is asking me is कि if you have already dropped, why am I asking you to pick a branch? If you have already dropped, I'm asking you to pick a branch irrespective of the degree, or because those life has to move forward. You, until and unless we do not move forward, देखो, if somebody has already dropped 2 to 3 times, he wants a clinical branch, but somehow for whatever XYZ reason he's not able to get it, I will not ask him or her to drop for the 4th time also. You will have to pick whatever you get, make the best out of it, and then modify the things as and when life happens further. That is why I always say this, firstly. Secondly, for the students who have decided that you will be dropping, that is the third category, not satisfied but not able to study also. I can actually divide this category, these students, into two categories. Those who will be getting a DNB clinical in this time, they will be picking up a DNB clinical seat also, but they will be giving the NEET 2022 paper. Dekho, that is why the competition in NEET 2022 exam will be huge. The biggest indicator of this was this INI mock counseling, which a pathology in INI, which normally goes till about 3500 or 4000 rank, this time got over around 8 900 rank only. This is because majority of the students are picking it up. They might or might not leave the seat later depending upon whether they like the branch or not. So khud socho, there will be seat wastage. There will be a lot of seat wastage. You can pick up a seat in INI. You can do it for 4 to 5 months जब तक काउंसलिंग नहीं होती. फर्स्ट राउंड अटेंड किया, सेकेंड राउंड अटेंड किया, you get a seat of your choice in NEET, and as a result you will be leaving INI. I mean, many students will be doing that. Many students who will be picking up DNB clinicals in this NEET PG 2021 counseling, whenever it happens, जो students DNB clinical उठाएंगे, of course they will be giving NEET PG again in 2022, because the gap will just be 1 to 2 months. Why will they not give the paper? They will be giving it. So the competition in NEET to PG 2022 will be huge. So actually a very sincere suggestion for all the mid rankers also. This is true with respect to all the mid rankers also. However tough it seems at present, hopes high हैं. We are at wishful thinking stage. Hopes are high कि the court will decide in our favor, whichever that favor is, that the court will decide in our favor, and we will be getting a preferred branch in this counseling itself. That is the hope. But keep on studying even this category, क्योंकि बच्चे अगर कोर्ट ने कुछ उल्टा डिसाइड किया, गॉड फॉरबिड इफ द डिसीजन डज नॉट सपोर्ट यू, ऑफ कोर्स यू विल बी अपीयरिंग इन नीट. ठीक है, डीएनबी हम उठा लेंगे, बट नीट पीजी में भी तो पेपर देंगे, क्योंकि दोबारा 1 to 2 months में ही पेपर हो जाएगा. सो which student category will be more benefited at this point? Those who were studying, या those who were under stress, continuously watching news, neither enjoying life? देखो इस टाइम पे कोई भी enjoy तो नहीं कर रहा, except the topmost ranks. Nobody is very happy and nobody is enjoying life per se. I mean, that though I can very safely say. So yes, they will be eligible. Leaving a clinical seat in INI, 5 lakh years, Satvik, it does not matter. The penalty, whether you leave clinical or paraclinical seat, it does not matter. The penalty, I think, is approximately 5 to 8 lakh. And is this a huge amount? Actually, वैसे tell me this also. I mean, your thought process and my thought process will always be slightly different, because I will consider things in the long term. If you are getting a branch of your choice in NEET PG, suppose that is a 30-year decision, this amount is nothing. You will be leaving this INI seat and you will be joining a clinical seat or a branch of your choice in NEET PG. This 5 to 8 lakh will be nothing, yaar, firstly. Secondly, INI will also be paying you. I mean, AIIMS at the pay, first year PG pay, I think, is approximately 1.1 lakh. 2-3 महीने की तो पे भी आ चुकी होगी. So a lot of seat wastage is actually going to occur, because this is how toppers or majority of us think. This is not a huge amount. पहली चीज़. दूसरी चीज़, you had asked me कि after picking a seat, will you be eligible to appear in NEET PG? But after DNB, you can leave your DNB seat and you're eligible for NEET PG. At least that has always been the norm until something changes this time and new notifications come. This has always been the norm. तुम एक DNB seat छोड़कर you can pick up the MD seat, but you will not be eligible to pick the DNB seat again till the time that DNB tenure is over. So DNB छोड़ के MD उठा सकते हैं, but दोबारा DNB seat नहीं उठा सकते. So this actually, I mean, consider the golden lining in this. All this delayed counseling and everything is actually a silver lining for the mid rankers who right now have a seat in hand, not a very good seat. Not a very comfortable seat that makes them smile or grin, but they have a seat in hand and they're eligible to appear in NEET PG 2022. This is the silver lining, provided you guys study. पढ़ने का मोमेंटम कैसे बनेगा? धीरे धीरे. अच्छा, बिफोर आई कम टू द मोमेंटम ऑफ स्टडीज, देवराज, नहीं नहीं देखो, नहीं, आई एम एक्चुअली ग्लैड दैट आई रेड योर कमेंट एंड आई एम ग्लैड दैट यू डिलीटेड इट. नहीं बच्चे, देवराज देखो, इट डज नॉट मैटर. MBBS is like your class 10 certificate. It is only used for date of birth. So it actually matters from where you have done your PG. So for all the juniors, this PG exam is actually your last exam. इसको एक बार अच्छे से पढ़कर निकाल लेंगे and life actually set है. So don't worry about it. Everything will turn out right. Firstly, secondly, the second group of students are the students who are for certain not getting a seat, who are for certain not getting a decent seat, or are getting a seat in a private college at huge expenditure. बच्चे, for the second category of students, of course you have to sit and study. इस चीज़ में तो कोई डाउट ही नहीं है. We will not enter into that wishful thinking. Writing the I'll Satvik, I'll come to you दोस्त. So the second category of students, इस category में तो wishful thinking का कोई point ही नहीं है. At some point you will have to start studying. Absolutely no doubt about it. Absolutely no doubt about it. So first decision that is to be made is, क्या हम लोग वो टॉपर्स वाली कैटेगरी में हैं? आर वी इन दैट टॉप कैटेगरी की वी आर गेटिंग अवर कंफर्टेबल सीट? If not, you are either of these two categories. Both of these categories, I can divide this into 2A and 2B. Both of these categories, especially 2A, you have a chance for a beautiful seat in hand. बच्चे थोड़ा सा पढ़ लेते हैं, बाद में हम देख लेंगे कि क्या करना है. As the court further decides, we will see what is to be done. So instead of, नहीं, डू नॉट ड्रॉप फॉर रेडियो. करंट मेडिसिन के लिए तो देखो आराम से ड्रॉप कर सकते हैं. डू नॉट ड्रॉप फॉर रेडियो. यू कैन ईजिली ड्रॉप फॉर MD मेडिसिन. आई एम सेइंग सो बिकॉज MD मेडिसिन पीछे तक जाता है. प्लस अगर सपोज बहुत अच्छी रैंक भी नहीं आई तो DNB मेडिसिन तो हम लोगों को बहुत आराम से मिल ही जाएगा. सो इफ यू want to enter into MD medicine and you are getting DNB clinical in this time, you are getting decent DNB, not medicine, बच्चे, of course you sit and study. DNB हम उठा लेंगे. To be on safer side, it will just be a matter of 1 to 2 months between the two exams, between your joining and giving the paper. Give the paper well and you will be able to get your desired seat. So इसको उल्टा सोचो. When you will be joining your DNB, meant to be, I know, I mean, even my mind was thinking the same. So when you will be joining your PG, or when you will be getting into DNB, you will have comparatively less time to study. So utilize this time that you have properly. There is absolutely no doubt about it. We cannot keep on thinking about the case all the time. We cannot keep on thinking about when the counseling is going to start. We cannot keep on worrying all the time. We have to utilize this time properly, and we as students have only one way to properly utilize the time, that is by studying. Absolutely no doubt about it. Next point, सात्विक दोस्त, DNB मेडिसिन तो आराम से जाता है. मतलब it goes till about 13-14K very conservatively. Even now it will go till that, hopefully, even after reservation. विदाउट दैट ऑल्सो अगर हम प्राइवेट कॉलेजेस का नहीं भी सोच रहे तो 18-19K तक तो जाता है. डोंट वरी अबाउट गेटिंग अ DNB मेडिसिन सीट, एज लॉन्ग एज वी जस्ट वांट कि हमें DNB मेडिसिन मिल जाएगा प्रोवाइडेड वी स्टडी वेल. Now before I go further, you had asked a very valid question. Is it difficult to find jobs post MD path in Delhi? नहीं बच्चे, it's not difficult. You can easily get a job MD path in Delhi, but the pay scale is on the lower side. When I talk about lower side, I'm comparing the pay scale with your clinical batchmates. MD path after SRship, after 3 years of SRship, earns approximately 1.4 to 1.6 L per month, which has increments, 10% increment every year, reaches to approximately 2 L per month in 3 to 4 years. Versus clinical, where the pay scale starts around 1.6 to 1.8, and एक बार patient होना शुरू करता है, so sky is the limit. So money is comparatively on the lesser side, but yes, jobs are there and job satisfaction is there, so don't worry about it. Current 6K, देखो 6K rank, I do not know whether it is a good rank, decent rank, or a borderline rank. I am saying so because I do not know the your dream branch. Rank is always dependent upon the branch that you want. If your dream branch is surgery, this is a very very nice, good, decent rank, no doubt about it. If it is radio, then it is not. So it totally depends upon the branch you want, and only you can decide what you want in life. So for all the students, actually for everybody which I am saying this, high time that you need to decide. Actually high time you need to decide. You need to write down your decision, whether we are going to study or we are going to pick in this school. If you have a borderline rank, instead of feeling frustrated, feeling low, or wasting away your time, please sit and study. Please sit and study. Absolutely no doubt about it. Do not fall into the trap of wishful thinking. And for the students who are actually, I am showing this video again, Elon Musk, I mean, as such, I'm a huge fan, but I am showing this video again because this is very, very applicable to our current scenario. So for the students who joined late, please have a look.
One of the biggest mistakes people generally make, and I'm guilty of it too, is wishful thinking. You know, like you want something to be true, even if it isn't true. And so you ignore the things that, you ignore the real truth because of what you want to be true. This is a very difficult trap to avoid.
So we will be avoiding this. And Karan Bashi, you should be getting medicine at this rank. I mean, let's keep our fingers crossed, and you will be getting into MD medicine this time. You will not need to drop again. Firstly, 6 to 7 hours of good hardcore study time is actually sufficient. When you say 6 to 7 hours, if you are sitting for approximately 9 to 10 hours, then your effective study output will be approximately 7 hours. So that is what we want in life ना. अच्छे से 7-8 घंटे हम अच्छे से पढ़कर निकाल कर ख़त्म करेंगे, and life will be beautiful, no doubt about it. So हो जाएगा, करण हो जाएगा, don't worry about it. So done है. I just wanted, these were the 2-3 points that I wanted to discuss in this. Please decide. Please decide firstly. Secondly, start with the final year subjects: surgery, medicine, peds, obs, gynae, followed by path, pharma, PSM. Do these 7 subjects, give them 5 days per subject. 35 days चले जाएंगे. Till then we will have a much clearer picture. I always say this. And the major effect of delayed counseling will be that the competition will be more in NEET PG 2022, firstly. And secondly, of course, there will be seat wastage, no doubt about it, because इस time पे अब की बार जो counseling होगी, majority of the students will be picking a seat. Everybody wants closure. They will be picking up a seat. So up ki baar ranks will be, there will be a slight negative shift, no doubt about it. People will pick up seat, and before NEET PG 2022, again in NEET PG 2022, they will give the paper and they will be dropping the seat also. So to avoid all this, there is only one thing that we can do from our side. That is, be calm, sit and study. It's not easy. It's actually not easy, but karna to hai. Not at all. Not at all. Sudarshan, ortho is not saturated, बच्चे. बहुत patience है, बहुत patience है. Don't worry about saturation in ortho. Rishikesh, obs gynae at 7K. Those, it will depend. You should be getting obs gynae either through ऑल इंडिया कोटा और स्टेट कोटा. 7K पे ऑब्स गाइनी तो देखो तुम्हें मिल ही जानी चाहिए, अंटिल रिजर्वेशन के कारण बहुत ज़्यादा नेगेटिव शिफ्ट आ गया, द चांसेस ऑफ विच आर लेस. देखो 7K यू शुड बी गेटिंग ऑब्स गाइनी, नो डाउट. टिली बच्चे, आई डू नॉट हैव योर, अच्छा, DNB एग्जाम, इज इट मोर डिफिकल्ट टू पास टेक्निकली स्पीकिंग? Isn't it superior to MD? No. I mean, get this totally out of your head that DNB is superior to MD. That is the only way it is not. Firstly, secondly, in government setup, while giving government jobs to assistant professors, associate professors, and so on, still MD is preferred over DNB. And lastly, but if you are entering into private practice, DNB is considered equivalent to MD, though with a slightly lower pay scale. This is the hard truth or the harsh reality of DNB exam. Done. So on this positive note, पढ़ना तो है ही, पढ़ना तो है ही. All I can say is bestest of luck. See, what you guys want is clarity of the situation, कि हमें गवर्नमेंट हमें बता दे कि this is what we are going to do and we will adapt. What I am asking you to do is that even if the situation is not clear, even if everything is blurred at this point, still utilize this time extremely well. Do not enter into that frustration wala phase. Do not keep on thinking about things that are out of your hand. What we can do is hard work, and we will be doing it, and we'll be doing it for the juniors, which for those who will be appearing in the mid-year FMG exam, as well as for the NEET PG. I mean, nobody does the crash courses better than Unacademy. I mean, no doubt about it. You can use the code PATHOUA, that is Patho Unacademy, for additional discounts. Done. Thank you. Take care, and let us hope everything becomes clear and turns out well extremely soon. Take care, bache. Take care.